Dr. Katy Kamkar, a clinical psychologist at the Center for Addiction and Mental Health, joins us in our Toronto studio. Dr. Kamkar, tell us what you know about Clara Hughes.
Well, we know that she has tremendous amount of physical strength, psychological strength, and emotional strength. So we can all be just so proud of her, and what she is doing really is so important in order to be able to talk about mental illness, to really increase the conversation about mental health problems so that we can finally normalize just talking about mental health problems, just as we can easily talk about cancer, stroke, and heart disease. So it's such an important initiative that is really taking place.
What do you believe holds us back from thinking of mental health in those terms, as you said, in the way that we refer to cancer, heart? Why is mental health associated with such stigma?
Well, the thing is that 1 in 5 individuals, 1 in 5 Canadians will suffer from a mental health problem sometime in their lifetime. So no one is immune to mental health problems. But unfortunately, because of the stigma, for a variety of reasons, it could be shame, it could be embarrassment, it could be lack of understanding, it could be limited support. For a variety of reasons, people might not, people are just going to suffer in silence and not going to really talk about that they are suffering or that they need help, and in turn seek treatment.
I want to refer viewers to the scene that's going on right now. Some of the other riders who are going to be accompanying Clara Hughes on her ride that began today, 12,000-kilometer long, 110-day mission. I want to talk about 1996. Clara Hughes has often spoken of this. She said she seemed to be on top of the world at the Summer Games in Atlanta. She won 2 bronze medals for cycling. No one, including Hughes herself, she said, could predict that she would slip into a depression so severe that she felt utterly useless. Doctor, I wonder, does mental illness come on like that without warning, with no apparent life reasons?
There are significant individual differences. So yes, sometimes absolutely it can come with no specific triggers or stressors. Sometimes it can come from difficult childhood, trauma, abuse, or specific life circumstances, very upsetting events that can occur in our lives. So it does vary. But what's important to know is, once again, no one is immune to it. So anyone can be affected by depression. So if we do not suffer from depression per se, we all know of someone who does suffer from depression or from another mental health problem.
Where do people like Clara Hughes come in? Does that kind of strata of celebrity help? Have you been able to see some tangible return on this kind of attention by celebrities?
Very much so. When we have celebrities and very high-profile individuals who talk about their internal personal struggles, it helps tremendously in terms of passing the messages, in terms of improving and increasing communications around. So we have noted significant change, absolutely.
I want to bring in a graphic that we have prepared, Clara's Big Ride, part of the Bell's Let's Talk initiative. The key points in the program: 1 in 5 Canadians experience mental health at some point, mental health illness at some point in their lives. Yet 1 in 3 doctors you mentioned don't get the help that they need. Health Canada spends just 5% of its budget on mental health, but mental illnesses total 15% of healthcare expenses in Canada. And mental health issues are the #1 cause of workplace disability, costing the Canadian economy $51 billion each year. So,
exactly.
Yeah, I mean, there were many ways in which this should be addressed. Clara has a history of mental illness in her family. Her dad was diagnosed as bipolar and alcoholic. How much does a genetic component make up as a determinant to what may happen in generations ahead?
There are a variety of causes. So genetics can play a role. It could also run in the family. Sometimes it could also be certain, again, environmental stressors or trauma. Or sometimes, people might say that, I do suffer from depression, but that there is no family history of depression, right? So it could be, again, because of a specific stressor, or again, certain life circumstances, again, that might have triggered the depression. So it really does vary. But overall, we really need to appreciate that there could be multiple causes, multiple factors that are involved. And the other thing is, as you mentioned, again, so many people suffer from mental health problems, along with the $51 billion annually that really all of us are affected, is that if a mental health problem goes undiagnosed or untreated, it can also increase very much so the risk for other mental health problems because, again, of the comorbidity and co-occurrence among all the mental health problems. So if depression goes undiagnosed and untreated, it can really increase the risk for anxiety disorders, substance use, substance abuse and addiction, etc., etc.
As we mentioned, 6-time cycling and speed skating Olympic medalist Clara Hughes embarking on a 110-day, 12,000-kilometer journey through every province and territory of Canada to raise awareness and money for research into mental health. Clara's Big Ride, as it's being known, part of Bell's Let's Talk campaign to raise awareness about mental health, and we're so glad to have you with us as well today, Dr. Katy Kamkar, a clinical psychologist at the Centre for Addiction and Mental Health in Toronto. Good speaking with you, and thanks so much.
Thank you.